When you think of a hospital, you probably think of doctors and nurses, right? But what really keeps the whole place running? It's this incredible, complex web of technology. Everything from patient monitors to x-ray machines. Today, we're going to pull back the curtain on something called healthcare technology management. It's the vital, often invisible system that makes sure all that life-saving equipment actually works when it matters most.
So, to really get why this is so important, let me ask you a question. In a place that's packed with expertise and life-saving skill, what do you think is a hospital's most hidden vulnerability?
Yep, it's the technology. Just think about it for a second. When a ventilator fails, that's not just an IT issue. That's a breathing issue. When a diagnostic machine gives a wrong reading, the entire course of treatment could go off the rails. It is a silent vulnerability that can have absolutely devastating consequences.
All right, so here's our game plan for this explainer. First, we'll look at a hospital's lifeline. Then, we'll nail down what HTM actually is. We'll talk about organizing for success, what happens on the first day for a new piece of equipment, the giant task of creating an inventory, and finally, we'll see how the system is the solution.
Okay, let's dive in. Picture a busy surgical ward. A ventilator suddenly stops working. In another room, a machine spits out a faulty reading. This is the kind of chaos that happens when there's no system in place to manage the technology that is literally the lifeline of a hospital.
So, how do you prevent that chaos, right? How do you make sure every single piece of gear is safe and ready to go at a moment's notice? Well, that's where the solution comes in. A dedicated system known as Healthcare Technology Management, or HTM for short.
But what is HTM really? It's so much more than just fixing things when they break. It's the entire framework. We're talking policies, procedures, and of course the people who manage a device from the day it arrives to the day it's retired. And the goal? It's simple, but man, is it critical. Keep it safe, effective, and always available for patient care.
And just so you know, the principles we're discussing today, they actually come from a series of guides specifically designed for health sectors in developing countries. So this isn't some pie-in-the-sky theory. It's all about practical, on-the-ground issues you'd find at a local hospital.
Okay, but a great system on paper is one thing. How do you actually make it happen? How do you get everyone organized for success? Well, it all kicks off with having a really clear structure in place.
And that structure is basically top-down. You've got the big national policies starting at the government level. Then that flows down to the provincial level for regional management, then to the district level to coordinate everything locally until, bam, it lands right where the action is, the hospital.
And again, this isn't just a textbook example. This exact model was actually recommended by the Ministry of Health in Zambia. They found it to be a really practical and effective way to manage their healthcare technology across the entire country. All right, let's zoom in a bit, right to the hospital level. At the very heart of this whole thing is a committee, and you gotta see who's at the table. It's not just the tech experts. You've got the finance officer, the person in charge of purchasing, and this is key, representatives of the people who actually use the equipment, like doctors and nurses. And that's so important because it means big decisions aren't being made in some back room without any real-world input.
So, the team is in place. Now what? Let's say a shiny new piece of equipment arrives at the hospital. You can't just wheel it into a room and plug it in. Nope. It has to be officially commissioned. You can think of it as its official first day on the job.
And that first day is a big deal. It follows a super strict 5-step process. First, you prepare. Check for all the manuals and accessories. Next, you run critical safety tests. Then function tests to make sure it does what the manufacturer promised. After that comes calibration, which might even mean adjusting for local altitude. And finally, and this is huge, you record everything. This creates the permanent file that will follow that device for its entire life. And listen, this part is absolutely non-negotiable. It doesn't matter if the machine was purchased for $1 million or donated by a charity. If it's going to be used for patient care, it has to go through this exact same process. Period. No exceptions. So, a new machine is commissioned and ready to go. It's now part of the hospital's family of equipment. But what if nobody knows what's already in the family? That brings us to the next foundational step. And honestly, it's a huge one. Creating a complete inventory of every single piece of medical tech in the facility. I love this quote from the source material because it just perfectly captures the scale of this task. It says, every room, cupboard, drawer, worktop, shelf, and storeroom must be investigated. Can you imagine? It's a full-on meticulous physical search to find and document every device. It is a massive undertaking. So, what's the payoff for all that work? Well, every single item, from a simple thermometer to a complex MRI machine, gets its own unique inventory code. That number becomes its identity for life, allowing the hospital to track its maintenance history, its current location, and its performance over time. It's how you turn total chaos into an orderly system.
So let's pull all these threads together. We have the right people in place, a rigorous process for new equipment, and a master list of every single device in the building. See, these aren't just separate chores. They are all essential, interconnected parts of one single powerful idea. The system itself is the solution.
Because when this system actually works, you feel the results on the hospital floor. Improved equipment availability isn't just a buzzword, it means fewer canceled surgeries. Increased patient safety means you can trust the data from a monitor or the dosage from a pump. Ultimately, a well-managed system doesn't just protect equipment, it leads to better healthcare outcomes for every single patient who walks through those doors. So I'll leave you with this final thought. If we agree that all this technology is the very lifeline of modern medicine, then who's checking its pulse? And now you know the answer. It's the hidden but absolutely essential system of healthcare technology management.